Welcome to Tea Time with Dr. K, where we share stories that inspire transformation, celebrate victories, and dive deep into the journey of health and wellness. Grab your tea and let's build a better you, one conversation at a time. Thank you for joining us for another episode of Tea Time with Dr. K. We have a very special guest here today. Her name is Lindsay. Lindsay, thank you for joining us.
Thank you for having me. I'm excited to be here.
Thank you. And so today she's going to share her journey with us, how she first met us, what kind of procedure she got done. She actually got done some procedure this Monday, and she's here today. And how was her experience? How is she feeling now? And then we'll go to later stuff, a little down, further down the episode. So, okay. Lindsay, tell us how you found out about Millennium Smiles and my practice.
So my office is just past here, 2 minutes. And
2 minutes.
2 minutes.
Nice.
Yes. And I was driving past it for a while and saw the sign. I like the name, for one. Love the name.
Thank you.
And I really did not like my previous dentist.
She's just speaking the truth. It's okay.
So it was already in the back of my mind that I was looking for a new one. So that's how I found this.
Okay.
Yeah. Mm-hmm.
All right.
The first time I came in, I cannot remember who was at the front desk at that time, but she was super nice. Had, I think, a cleaning the first time, and then
the life got ahead.
Yes. Yes.
Then she had a lot of, things that had come up, but we brought her in this year, and you had some silver, mercury stuff in your mouth, right? And
yes.
We discussed that. And how it was important for us to remove it safely. We have a procedure called
the SMART protocol.
The SMART protocol, which means like safe mercury amalgam removal technique, where we safely remove the amalgam from the body. Mm-hmm. So do you remember? I mean, by the way, she wanted to be
sedated.
And then I was like, do you remember? Because before the podcast, we talked about it. And I was like, yes, we did this. She goes, I don't remember. I just remember that when I went home.
Yeah, I do. I came in Monday to get everything done in one day, which was nice for scheduling purposes, just to knock it all out at once. So, I got here at 6:45 in the morning, maybe, and up until about 12:30 is a little fuzzy, and after that, I remember more. So the sedation was nice because in my mind, the whole morning seems like it lasted 5 minutes.
Oh, that's great. Yes. And by the way, she did fall asleep. She'd be like dozing off. I'm like, yep. She is asleep.
Yeah, so that's nice.
Yeah,
that was easy. And I remember the afternoon, I had a filling or 2 fillings.
Oh, you just remember the last one.
I remember that part, yes.
And I believe you had 4?
I think 4 crowns or
yes,
whatever it was.
Yes, 4 crowns with the process of silver filling, amalgam silver, a safe mercury amalgam removal technique, which is basically, I'm a certified provider with American Academy of Toxicology and Medicine.
Yeah.
A lot of us these days are exposed to, of course, parasites, but also a lot of metals and stuff. And so the last thing I want to do is when I remove a silver filling from a patient's mouth is to introduce more toxicity in their body.
Right.
And those mercury can actually pass the blood-brain barrier. And studies have shown, in combination with some sort of sleep reading disorder, that 75% of the patient can develop some sort of, Alzheimer's disease, dementia in later years in life. And so I take it very seriously in the process of removal. Do you remember what I did exactly?
I wish that I did, but I do not. Okay. I remember you telling me about it. And that's why I went ahead and did it too. I mean, it felt like with my age, right? Things are starting to move around in there, and I wanted to make sure that it was all out and that it was safe.
And it leaked too.
Right? Yes,
it was definitely leaking. She didn't receive Halcyon, which is a levels 1 sedation. She's still awake and knows what's going on. And she had a smoothie as well. You remember you had a smoothie?
I do remember I had a smoothie.
Yeah, you had a smoothie. But the way we did it was that we covered, we put 100% oxygen on her nose during the process of removal and cover her head to toe from a surgical drape, and also place and isolated each individual tooth where we removed the silver filling because we didn't want her to ingest any part of it. And we used the amalgam separator to completely get it out of that, from the suction. It's different than regular suction, we use for the patient that separates the amalgam so it doesn't go to the water of the community either. But it's really important that how we do it is safe to remove it. And also it goes to a biohazard bag and the extra amalgam gets out of the office as well. Yeah. So that's how we did it for you. And I don't remember, much part of it, which is great because that was the whole purpose of it.
Yeah.
She wanted to be sedated. She was a little anxious, but at the same time, we wanted all the work to be done so she doesn't have to take multiple times off from work.
Definitely. This time of year, that's super important. To just take one day and knock it all out is just 1,000 times easier than having to go back to work and be numb or whatever. So, yeah.
And did you do what I asked you, the salt water?
The salt water I did. And I was going to say that the girl, Jazz did the laser treatment afterwards too. And then I did salt water roughly every hour on the hour that evening. So, yeah.
That's awesome. Yeah. So one of the things that I always tell patients for post-op is to make sure, because, where we do the restoration is not going to be as uncomfortable, although sometimes there's a little bit of cement that we have to remove. The gum may be a little irritated. But I say for the healing process, it's so important, especially the injection site, to do salt water, because that way, you heal faster.
Yeah.
And she was here on Monday, and now it's Friday. How do you feel?
I feel fine. I was sore Tuesday when I woke up. It felt a little, bless you, it felt a little, a little beat up Tuesday morning, but by Wednesday everything was fine.
Everything was fine. Yeah.
Tuesday I ate soup still.
Yeah.
But Wednesday fine.
Yeah.
Totally
worked. She had I think 6 teeth worked on, right?
Yes.
Yeah, 6. Yeah. So, it's a lot of work and all the different areas. It wasn't just one area. I was here.
Honestly, I think most of the soreness was just from having my mouth open for so long. I don't the teeth haven't really bothered me at all. I think it was just from being open.
The soreness was actually from the jaw opening.
Yeah.
Because there was a lot of work that needed to be done.
Yep. That's it really.
So tell me, overall, would you rate what I did for you, from 1 to 10? 1.
Oh, 10 out of 10 for sure.
Really?
Yeah, for
Even though we were sedated?
Well, yeah, that was great.
Well, then I'm getting a 10 out of 10.
That's the best part. Everything was really comfortable. It was easy. I think I scheduled it I was here the week before for a cleaning and we scheduled it for Monday. So it wasn't like it was months out. Sat in the massage chair for 20 minutes.
Yeah.
While I was getting ready.
5 minutes, she forgets.
Oh, 45, I don't know, however long I was. It was great. I thought it was really sweet that you ordered me a smoothie too, because I probably would have been starving if I was conscious enough to know I was starving.
Yeah.
It was nice.
That's awesome. And
they're little perks,
We always do that, by the way. I know you say that.
Mm-hmm.
If it wasn't all of your mouth, then I would have actually gotten maybe either Chick-fil-A or fish or something.
Yeah.
But because she was numb everywhere, I didn't want her to have a sandwich in the cheek side and then bite your cheek inside.
Yeah.
Because then it would take 2 weeks to heal. So
I don't think I would have been able to move my mouth.
It
was so numb.
It was everywhere. So that's why. But we always feed our patients, especially when we do any crown in our practice.
Yeah.
We always either offer breakfast or lunch.
Yeah.
And that's something I've done for years since I opened my first practice. Even when I was an associate, believe it or not.
Yeah.
Patients never tell you if they're hungry because they don't want to be a burden.
Right.
And it's the responsibility of us, the doctor or the assistant to ask. And even when I was, working as an associate, I didn't have the same day crown, but I just knew the patient would be tired. And I'm like, can I get you some food? And I actually would give part of my food to the patient. They had no idea it was my food. But my assistant was like, what would you do? I was like, well, there's not a close place here. And I'd rather just have her eat something.
Yeah.
So that was it. And then I told myself, when I open my own practice, patient will be served breakfast or lunch if they're here for a few hours. And when we do same day crown, you were here for 6 teeth, but
and I left at 3:30, I think. So I was here all day. Yeah. So I would have been starving.
Yeah, exactly.
So
and the thing is that and the thing is that your body sugar level can drop and you can go to a little shaky mode. We don't want that to happen,
right?
Yeah. So that's that. So now let's talk about, I know you've been a real estate agent.
Yeah.
And can you tell our audience, why do you love doing real estate and how long you've been doing it?
Yes. So I got my license in 2006. So I'm going on 20 years. So
20 years.
yeah,
Woo-hoo!
long time. I was in the apartment industry prior. And when I had my first son, I was like, I can't go back to a 9 to 5 and leave my kiddo somewhere with a stranger. So that's kind of how it started. I had no idea at that point what it would evolve
Freedom.
but yeah.
Of doing your own thing.
Mm-hmm.
Yeah.
And it's been really great. As like a working mom, it's been nice to be able to be present for my kids and have that flexibility. And I have had such great clients over the years that have always, worked with me if we had a school event or a baseball game or whatever. So it's worked out really nicely. And it's just kind of evolved into a great career. It's been really good for me. I grew up in Frisco and I live and work kind of around this area. So it's just...
I think a lot of people know you. I mean, I think before she came in for her cleaning, I was driving in the Little Elm area, and then all of a sudden I saw you were in some bulletin.
At the stadium.
The stadium. I saw right on that was Lindsay. Oh, yes, my patient right there.
There's a digital billboard there.
Yes, I saw that.
So I try to stay really involved with our school district. I think supporting the schools is so important. So supporting the teachers specifically. So I try to stay involved in our school district. So I do some advertising and stuff kind of in the district.
Nice.
Mm-hmm.
Nice.
But I love it. It's fun. Like probably like you being with your patients. It's just the same. Like the process of showing somebody houses and them finding something that they love or an investment where they make money or, whatever that is. It's just, I think it's great.
So you may not know this number, but I'm going to ask you. Maybe you'll know, maybe you don't know.
Oh, gosh. Okay.
It's not a hard question.
Yeah. Okay.
But, just a ballpark. Like, it's an American dream to buy your first home.
Definitely.
Right? So, and you just mentioned investors. So I would say what percentage of the people who you help with, you make their dream come true?
100. Well, to this day, I have never sold someone a house.
Good answer.
Yeah.
I haven't been expecting that.
I've never had somebody call me 6 months later and say, oh my God, I hate my house. I've never had that happen. Ever, ever, ever. And I have someone closing on Monday who we have been looking and looking. And there's a lot of inventory right now. So that's a little bit different. And we just kind of weren't finding the one. And I have a friend who works for a builder and talked to them. So they ended up, the builder was offering all these interest rate buy downs and whatnot. They ended up being able to spend a lot more money than they thought they would.
Yeah.
Got this massive house for their 3 kids. They're closing on Monday. And when she found out that it was all going to happen, like at the table signing her contract, she burst into tears because she's so happy.
That's awesome.
Yeah, like that.
That's what that drives you.
Yeah. I mean, it was the sweetest thing, and I think that's important. She wanted somewhere great where she can see raising her kids. And
is that the first home?
No, they're moving here from the Houston area, but she's being relocated for work. And, finding a spot in a new area is scary, right?
It is.
So
you want to make sure you're getting the, good location, good school.
Yeah.
I mean, good proximity to grocery shopping,
right. All the things,
sports, activities, things like that.
Yep.
So what percentage of those people you think, I mean, I know you don't write down the numbers, or over the past 20 years, you think have been first-time home buyers?
Oh, gosh. Maybe 25%.
And the rest are investors or second home buyers?
Mostly second home buyers.
Okay.
But I own a property management business. So I have a group of investor clients, that I work with, that I manage their homes for them when they're either buying for investment or they keep their home for an investment when they move up to the next house.
Oh, cool.
Yeah.
So tell me this, how can someone find you if they want to get to know you? I mean, maybe you can drop maybe we can ask Kevin to drop a link and a phone number, an email address, whatever. But if you want to say it right now.
Yes, my phone number is 214-683-5476.
And she's married.
I'm married.
She doesn't need a boyfriend.
Do you need a boyfriend? No. Tell us to me. I have an Instagram. I have a Facebook page. They're both at Lindsay Reyes Frisco Realtor.
Lindsay Reyes, Reyes. Yes, because not everyone knows how to spell right. I had to look it up. The first time you see the name, you're like, okay, how do you spell that?
Yeah.
So Lindsay Reyes at
my email is Lindsay at Christie'sRealEstateLS.com.
She couldn't make it any easier. And make sure Ken let me get that right. So let's go now to the next topic.
Okay.
All right. So you told me a while ago you were married for 24 years.
Yes. Mm-hmm. My husband, Ruben, he came in to pick me up.
Yeah.
So he was being
I saw. Oh yeah,
being silly with Suzanne, I think. He is a firefighter in McKinney.
Nice. Yeah. I didn't even know that.
Mm-hmm.
Okay.
Have 3 adult kids, 2 kids at home, and 8 grandkids. Yes.
Not shocked. I didn't go that far.
They're everywhere.
How old are your kids?
We have together. We have a 16 and a 19,
and then he has a child.
We have 3 adult children that were his from a previous marriage.
Okay,
they're fine. They have been with me for a long time. Yes, and they're all in their 30s.
Your grandma.
I'm a Gigi.
It's not a grandma. Okay,
we don't do grandma.
Okay, sorry, a Gigi.
Yeah, we're Gigi.
So, when you've been married for 24 years, I mean, that to me is a successful marriage.
Yeah.
Of course, marriage has its ups and downs, but
yeah,
I would say, like, what has been the most, I would say, sacrificial, like, conversation or difficult conversation or good and bad, or some of the pillars that kept you guys together all these years? Like, what would you say the 3 top things that helped you guys like stick together like a glue 24 years later?
Yeah.
And it's still going.
I think number one, our family is important to both of us. Mm-hmm. So that, kind of is the glue. But I think we're friends. It's not, I mean, we laugh a lot and we both like to have fun, and I think that's important, where it's not just all the hard stuff all the time. You can have some fun in between. And the third thing, gosh, I don't know, like just not getting divorced, right? That keeps you together. I mean, there's probably throughout 20 years been plenty of times that we're both like, see you later. But
then how do you overcome that? Then what happens?
I think everybody, you calm down and you take a check of what you really want in your life, right? And if you still want that person in your life the next morning, then you just move on, right? You move on to the next thing.
So do you hash it out, talk about it, communicate?
Sometimes we do, but after 20 years, then, there's times like 2 days will go by and we're both just like, are we over this yet or not? Like, if it's a serious fight or if it's more about like, you didn't take the trash out, you're making me crazy, one of those things. Yeah. And most of our fights are those things.
The little thing, the
little, annoying each other, right? And by 2 days later, you're over it and you move on. Yeah.
Okay.
Yeah.
That's awesome. So one more thing I was going to ask you. How do you guys support each other in your life? Like, what has been the biggest thing that you felt like, okay, he supported me this way, I supported him that way, and then that I believe that can actually help grow the relationship and make the bond stronger.
Yeah.
So how has he supported you, and how have you supported him in his life goals?
So Ruben's very supportive of me. He really is. Ruben is he likes to do things for you. Like, that's his love language, right?
That's a masculine man.
Yeah.
And a man wants to do something for his woman. Okay.
He like he's the type that's like, what do you want for lunch? Or what do you want for breakfast? He's constantly, feeding me and bringing me water. And he does
acts of service.
Mm-hmm, yeah. Acts of service. Yeah. That's definitely his love language. So, my schedule can be a little bit chaotic. I'm here, there, whatever, and it's different every day. So he, especially when the boys were little, he had to pick up the slack on that, and he always did. Like, he doesn't complain about anything really. So he's kind of always there when I need him to be, which is great. I don't know what he would say that I've done. I'm definitely probably he's much more easygoing probably than I am. He is talking.
Well, you know who he marries. Like,
yeah,
they always do.
Yeah,
they know who the person is in front of them. They always do. Okay.
He would like to probably retire in the next year or so. So I will be figuring out that phase of things and how I will support him through that.
That's awesome.
So I don't know yet. We'll see.
We'll see that. Many will comment on the second podcast with us later.
Yeah, you can have him on and talk to him about retirement.
That's right. How's he doing that?
I don't know. Oh my gosh. I don't know. We'll see what happens.
Well, thank you so much, Lindsay.
Thank you for having me.
Of course. And, any other words of wisdom you would like to share with our audience?
I mean, I would highly recommend it here. I think dentists, people are scared of dentists, right?
Yeah.
Sometimes. And I've had nothing but a good experience. The girls were all very sweet.
Thank you.
Dan obviously is wonderful. Jazz was in the room with me. She was great. So I have nothing but positive things to say about it. So
I appreciate it. Thank you so much for coming to our podcast.
Thank you
for sharing. And remember, she's a wonderful real estate agent for 20 years. And if you are looking for a new home or looking for someone who can find her second home or investment property, please reach out to Lindsay at
ChristiesRealestateLS.com.
That's right. And the phone number will be listed below.
Yeah.
So stay tuned for more amazing testimonials coming here at Podcast Tea Time with Dr. K. Thank you so much, Lindsay. Thanks for having me. Thanks for coming. Thanks for having me. Thanks for being on my podcast. And you don't have to edit it.
Having me.
You don't have to edit this, Kevin. We can be a little bit of this. Thank you for having me. Stay tuned, you guys, for another amazing podcast to come. Take care.